Welcome to the May 2024 PSV training. Today we'll be discussing the CTE Caregiver Guidebook. My name is Tyler Ambrose and I am the Peer Support Coordinator at CLF. If you ever need to get in contact with us, you can reach out to support@concussionfoundation.org. So what is the guidebook? The guidebook contains information useful for caregivers navigating suspected CTE. It contains lists of symptoms, treatments, providers, and other beneficial resources. Why is the guidebook useful? The guidebook possesses a large amount of knowledge helpful to caregivers of those experiencing suspected CTE symptoms and how to navigate this new journey. In a one to one connection, you can utilize the guidebook. There might be questions that partners come to you that could be answered by using the guidebook. Questions might be: what type of treatments or providers would be helpful for my loved one? Do you have any advice on how to talk to a doctor? Anything I should mention? Any tips on navigating this day to day? I feel like I'm losing hope. Any suggestions? All of these questions can be answered using the Suspected CT Caregiver's Guidebook. I'll take you on a brief walkthrough of the guidebook and highlight the key areas that would be beneficial for you to gather information from and why. The guidebook starts off with the table of contents, which give you an overview of what to provide to a partner. It starts with understanding a loved one's condition, especially with people who are coming to you with a fresh mind and new to this journey of suspected CTE. It can give them a little bit of insight. It can go into, non-concussive impacts are really important to understand, how CTE diagnosed, and then a reason why CTE cannot be diagnosed during life, but instead is called suspected or probable CTE. We then jump into the symptoms of suspected CTE. This is a great list to provide to partners who are kind of new to CTE and want to understand that some of the symptoms that are coming from different types of behaviors or just from CTE itself. Building a foundation of medical support is incredibly important, especially with CTE, finding the right doctor, finding the understanding treatments, and this is where it starts on this page. It's a great area to direct a partner to. When jumping into suspected CT treatments, it's best to provide them with evidence-based practices, which means that these are treatments that have been peer-reviewed, studied by multiple people, by professionals. This list of treatments is really helpful in managing CTE. It starts the treatment, the symptoms that it targets, and the typical providers for those treatments. It's about 2.5 pages long, and then it jumps into types of providers. The different types of providers that are specialized in different treatments. We have the provider type, the function of those providers, and the relevant specializations. The reason that this can be so beneficial to a partner is that some people are a little bit more visual, or they want to do their own research or look into suggestions that you've given based off of your personal experiences. And this is a great place for you to direct them to. After going through the providers list, we get into talking with medical and mental health care providers. This can be so beneficial as it can be kind of difficult to talk to a doctor for the first time or figure out how to talk to a doctor for the first time with CTE or suspected CTE. Maybe even getting diagnosed with suspected CTE, talking to a doctor can be quite difficult. And this page would be very beneficial for any kind of partner that needs to know a little bit more information. Then we move on to living with suspected CTE. I know that during this connection, you share a lot of your personal experiences of what you've gone through, tips and tricks and advice. This is also a great page that a partner can draw on, or that you can draw on, for giving advice on tips for daily living that could be really beneficial, such as building a support system, exercise, writing things down. And again, for people who are just a little bit more visual, this can be very beneficial. Being a caregiver and advocate is what this program is about, for a one-to-one connecting with those who are caregivers and how to advocate for those loved ones. This is a great option of anticipating the challenges, communicating with people who have suspected CTE, as those behavioral changes in communication can be a little bit difficult at times, or hard to understand from an outlying perspective. This gives that perspective, so that way it's a little bit more patience, a little bit more understanding can come. Self-care, again, incredibly important to understand as a caregiver, and something that we always push to be able to practice: proper rest, staying mindful, and then regular exercise. Mental health counseling is a must, and this is such an important part to direct partners to, because we don't want them to be burnt out on being a caregiver. We want them to be feeling fresh and ready to tackle the new problems that arise. When a partner comes in, we help create the resource toolbox, but you can always direct them to this page, the helpline, and all of the assisting numbers that we provide to them, as well as the peer support groups and the peer support connection that you are all a part of. The additional supports of the CLF helpline is great for providers and resources, so always feel free to direct a partner to the CLF helpline for any additional help. The videos and webinars, the stories of hope and resilience, and the research update of 1,000 Reasons for Hope are all great options for pushing a partner to continue having hope and really striving for the goals that they have in mind, and really providing them with the ability to keep going forward. The CLF guidebook can always be found in the resources tab under CTE Caregiver Resources. Anyone can sign up for it and have access to it, so please feel free to direct anyone there. The PSV Hub will also house all updated caregiver guidebooks, so use that as a shortcut for yourself, or if you're wanting to share this with someone else. We'll also have the Suspected CTE Caregiver Guidebook for Canada. There's small different changes in there, such as providers or phone numbers, but it's always a great resource as well. Thank you all for attending this month's training, and hope you have a wonderful rest of your day.